It's a house call for people who don't have a home.
A mobile team of healthcare professionals launched today to help vulnerable humans who are homeless in Austin right where they are. UT's Dell Medical School Integral Care and Community Care Collaborative just got $2.3 million in federal grant money to do it. This grant will fund supplies, evaluations, and the mobile team of full and part-time employees. KXAN's Alyssa Gord breaks down why this is something Austin's homeless say they really need.
Yeah, and I was having an asthma attack, and I had my muscles were breaking down as well on my legs. And
Paul Martinez was exhausted from walking the streets and wound up in the hospital.
For me, it's just I just don't want to go in there. I don't want to put myself in front of all these people and just me get judged or something like that.
Martinez fought his nerves and went into the community care clinic. He got a checkup and an inhaler. Turns out he is the exception. Many of Austin's homeless don't show up to clinics.
There's, many insurmountable barriers to care, from not having transportation or competing with basic survival needs.
According to the Ending Community Homelessness Coalition, 61% of Austin's homeless get health care through an emergency room or not at all.
We are targeting folks who are chronically homeless, who have a chronic medical condition, who have a serious mental illness, and have a substance use disorder.
The new mobile team plans to bring care to them. It'll be made up of 6 healthcare professionals, some primary care, some mental health, and others to help with substance abuse.
We can care for patients under the bridge if they're under the bridge, or at a local community agency or site if they feel comfortable there.
This program will have 5 years worth of funding to reach people like Martinez.
I would use it for sure.
Alyssa Gord, KXAN News.
Medical care and medications for patients this team serves will be covered by their insurance if they have any. If they do not, their care will be covered under Central Health's Medical Access Program.
And we went a step further today, asking local hospitals how this will help them and the rest of their patients who are not homeless. KXAN investigator Erin Cargile is here with what she's learned. Erin.
Good evening, guys. We wanted to know how many homeless patients they see, how much it's costing, and how this mobile clinic could free up doctors for everyone else coming into the ER. The Seton Healthcare family and Central Health say people who are homeless make up 12% of patients, and they're mostly men between the ages of 35 and 55. 3% of them use their ERs on a yearly basis. And here's the most common diagnoses: orthopedic-related problems, hypertension, mood disorders, and substance and alcohol-related disorders. Here's what St. David's said. They said care for homeless and indigent patients places an undue burden on local hospital systems. Last year alone, their healthcare system provided more than $75 million in unfunded charity care. And they went on to say a mobile clinic will allow medical problems to be addressed before they escalate and become emergent situations. Back to you.